Good afternoon. We will be starting in a couple of minutes. We're giving people a few minutes to dial into the webinar. Please dial in, check your audio, and we will formally get started in a couple of minutes. Good afternoon. Welcome to the webinar for 2021 hosted by the Community for Global Health Equity. The webinar series this semester, this academic year, is titled Building Blocks of Equity. This webinar series is about how academics at all stages of their careers form effective partnerships to guide their research and their work. We ask, how can students and early career faculty engage in research in Global South communities? How can students contribute to building equity? In this series, teams of mentors, mentees, and partners reflect on a series of questions that have to do with how we discover how co-produced knowledge can promote health equity for individuals. We try to understand the importance of training students to ethically and responsibly work with community partners. We learn how to develop reciprocal partnerships early on in academic careers. We discuss barriers to educating students on how to co-produce knowledge. Through these series of presentations and discussions that we have had this year, we've been able to learn about current research, teaching practices, and identify innovative practices, and some of those you will hear about today. Today's guests, today's panels, are Dr. Tia Palermo, who is an associate professor in the Department of Epidemiology and Environmental Health, a leader in the Community for Global Health Equity. Her research examines the impacts of social policy and population health. She is currently co-principal investigator of studies in Tanzania and Ethiopia, examining the impacts of government social protection programs linked with other services and complementary interventions on health and well-being. Prior to joining UB, Dr. Palermo was a social policy manager with UNICEF, where she led research on the impacts of social protection on child and adolescent well-being in sub-Saharan Africa. We are delighted to have her here with CGHE and discussing with us and sharing about training the next generation of scholars and co-producers of knowledge. Dr. Palermo is joined by Muloongo, Dr. Muloongo Simuzingili, who holds a PhD in healthcare policy and research from the Virginia Commonwealth University. She also holds a master's in applied economics from the University of Cape Town. She is currently a fellow with the Centers for Disease Control. Her research includes evaluating the health impacts and cost effectiveness of cash transfer programs on children's health in sub-Saharan Africa. She has conducted economic and climate assessments related to the response and impact of the COVID-19 vaccination rollout programs in the East Africa region for the World Bank. She's currently working with the University of Wisconsin-Madison, analyzing the expansion of public health insurance programs on women's health. We are delighted to have both of them join us today and lead us off in this conversation. Please join me in welcoming our guests today. Before I turn the screen over to them, I do want to alert our attendees that you are welcome to engage with your observations and your questions in the chat. We will be monitoring the chat. Please hold your discussion questions till the end, but please go ahead and raise your clarification questions as we move forward. With that, thank you, Dr. Palermo, and thank you, Dr. Simuzingili. I'm going to hand it over to you.
Thank you so much for inviting us to be here today. We're really excited to share some of this work. Next slide, please. So I'm going to talk a little bit about what the Transfer Project is and what we do. And then I'm going to hand it over to Muloongo to give an example of that work more specifically. Next slide, please. The Transfer Project is a community of research, donor, and implementing partners, including UN agencies such as UNICEF, the United Nations Children's Fund, and the Food and Agriculture Organization of the UN, as well as university partners. University at Buffalo, we participate in the Transfer Project, as well as the University of North Carolina, Chapel Hill, and several other African universities. It's also done in collaboration with national governments and national researchers at universities and also research institutes. We focus on coordination and efforts and uptake of results. So we conduct primary research, but we engage a lot in facilitating the uptake of that evidence with government partners. Our mission is to provide rigorous evidence on government-run, large-scale, largely unconditional cash transfer programs. So this rigorous research includes both experimental and quasi-experimental study designs of longitudinal studies with mixed method, both quantitative and qualitative research methods, to understand how anti-poverty programs in the form of cash transfers affect household well-being, including economic security and health. The reason that we focus on cash transfers is because income poverty has highly damaging impacts on human development, and cash empowers people living in poverty to make their own decisions on how to best improve their own lives. We work in the countries listed below, and today Muloongo is going to be presenting work from Kenya. Next slide, please. In terms of capacity building for research, we engage in many different activities. Some of these include research partnerships with national universities and research institutes in African countries. We also have a transfer project fellowship where doctoral candidates and recent PhDs within 5 years of completing their PhD who are African nationals based at African institutions can partner with the Transfer Project researchers to provide mentorship, to receive mentorship, and participate in joint research activities. We also conduct regional workshops every other year typically, and these are large gatherings of government officials who are working in the area of social protection, researchers, and development partners, including bilateral donors and UN agencies who are engaged in supporting policymakers to design and implement social protection programs. So when I talk about social protection, I'm referring to the set of policies and programs which aim to address poverty and multidimensional vulnerability across the life course with a focus on particularly vulnerable groups. Cash transfers are one form of social protection, and that's the one that we focus on the most in the Transfer Project. So these regional workshops are designed to help translate evidence for policymakers and to facilitate cross-country collaboration and dissemination of evidence that's coming from one country that could perhaps be used to help inform programs in another. Another way that we build capacity for research and evidence uptake is through data sharing. So we conduct these longitudinal impact evaluations, and then once the evaluations are completed, we share the data publicly so that researchers can then use those data. Next slide, please. So this picture is an example of one of our research outputs. This is a book which explains the origins of the transfer project in the early 2000s in the countries listed on the screen. So you can see the book is available free at the FAO website listed on your screen, and it talks about the different aspects of this research collaboration because it is very unique in that it's multi-country and focused on government programs. So these are not researcher-driven studies or programs or NGO implemented programs. We're implementing real-world policies implemented by governments. And what we're aiming to do is facilitate uptake of the evidence around the evaluation of these programs so that that evidence can be used either to tailor the programs to address some gaps in what we find in terms of effectiveness, or to advocate for scale up of programs if they're working well to improve economic security and reduce food insecurity and have other positive impacts. The book talks about kind of the political economy aspect of how these evaluations first came into being, as well as some of the very technical aspects of the research, and also about the numerous activities we do in terms of sharing the evidence and translating the evidence for maximum uptake. Next slide, please. This photo here is an example of our last transfer project workshop that we held in Arusha in Tanzania. Again, this was comprised of policymakers, researchers, and development partners. And we hold different sessions, and it's really meant to be a very engaged, usually 3 days, where there's evidence sharing, conversations, new agendas being planned, etc. Next slide, please. I also mentioned previously how we have this transfer project workshop, fellowship, where researchers based in Africa can collaborate with transfer project researchers such as myself to answer questions about how cash transfers impact health, education, and multidimensional poverty. They're also provided with training on impact evaluation methods through workshops, and we provide them with opportunities to present at workshops and international conferences. Next slide, please. Finally, so this is not a comprehensive overview of all of the activities we do, but it's a few examples. And one of the examples is data sharing. So we try to make as much of the data publicly available as possible to encourage African researchers from the region to use these data, but also anyone internationally can use the data. So this is kind of where Muloongo comes into the picture, where she used publicly available data from Kenya to look at the impacts of cash transfers on child health and nutrition outcomes. I was on her dissertation committee when she was at Virginia Commonwealth University, so we worked together on some of the framing of her research questions and interpretation of the analyses. Next slide, please. But if anyone is interested, you can go to the Transfer Project website and utilize these data. There's an application process, but there's no cost. And you can find more information about the Transfer Project on Facebook and Twitter. And if you have any questions, please feel free to email me. So that's an overview, but really the star of the show here is Muloongo. So I'm going to turn it over to her. Thank you very much. You're on mute.
Thank you. So saying thank you so much to you, Tia. And then, yeah, just saying my name is Muloongo Simuzingili once again. So I just thought I would start out by sharing a little bit about my background and like sort of like my progression to where I'm at now. So as mentioned, I did graduate from the University of Namibia with a Bachelor in Economics. I then went on to pursue a master's in applied economics at the University of Cape Town, where I had my first official job working for a longitudinal survey as a data cleaner. I did that for a couple of years and for about a year and a half, and ended up using that data for my dissertation and my master's program. So after I completed my master's, I started working for another research institute, the International Growth Center, as a country economist in my home country, Zambia, where I'm from. I'm originally from Zambia. But it was when I joined the Civil Society for Poverty Reduction as a programs manager that sort of shaped in terms of this way I started thinking about the things that I was interested in working on, and the way I was the change that I was trying to sort of contribute to. So as the Civil Society for Poverty Reduction was a civil society organization that advocated for adequate resource allocation to different social sectors to help vulnerable populations. So I was very much interested in asking these questions of, answering questions of, you know, if the government allocated a specific amount of the budget to the health sector, for instance, what are the implications of that? So I've been very fascinated by questions that have to do with these sort of resource allocation, and specifically on vulnerable women and children populations, because during my time work going into the community, I saw that this was actually a huge problem in terms of like adequate access to healthcare services and just poor outcomes for children. So following that and realizing my passion was actually in health, I applied to Virginia Commonwealth University. And of course, I got the PhD in healthcare policy and recently graduated in June. So I'm currently a CDC fellow, a prevention effectiveness fellow at the CDC, where my work has continued in terms of evaluating different policies and programs and the impact of that on vulnerable populations in the United States. So it's been a very exciting journey. And just to go into my dissertation, so my dissertation was titled Policies Addressing Low-Income Women and Children's Healthcare Utilization in the United States and Kenya, the Role of the Physician Payments and Cash Transfer Programs. So as mentioned, I've always been interested in this sort of resource allocation question. And with the available data that I had, I came up with 3 papers that would begin my work in this field. So in terms of framing of the entire dissertation, I was thinking of it of, okay, so government policymakers have a choice of how they can allocate their resources. They could either put money into supply side policies such as physician payments that would like for instance with Medicaid, that would increase the supply of healthcare services to the vulnerable population, since Medicaid covers the vulnerable population in the United States, the low income population also. So in that first paper, I assessed this relationship between the Medicaid physician payments and the association of healthcare utilization for women. But on the other hand, a policymaker can decide to invest in demand side policies, such as the cash transfers, where a vulnerable person can receive these resources, and it would alleviate the financial barriers to them seeking healthcare services. So that is the relationship that I was assessing in my second paper. However, noting that there is a trade-off in terms of where resources are taken, because if you invest in one particular program, resources are taken away from another program. And so I wanted to assess this relationship and decided to evaluate the cost effectiveness of this cash transfer program on healthcare, on health. And that's what I did in my third paper. So it was a very interesting paper using different data sets, because I used Medicaid claims data and I used the transfer data as well for 2 of my papers. And so the first paper that I looked at using the transfer project data that Tia took us through was, do economic preferences moderate cash transfer program effects on children's healthcare utilization? And the second paper that used the transfer data was whether our cash transfer programs cost effective in reducing infectious diseases amongst orphans and vulnerable children in Kenya. So for today, I'm going to speak more so about the economic preferences paper and just take you through some of the things that I did and what I found, just to give you a quick overview of that work. So in terms of thinking about the background and the framing of this paper, under 5 mortality is a problem in Kenya and is the leading causes of deaths. And these could be preventable and treatable with increased access to healthcare services. So a cash transfer program was implemented in Kenya, and this may improve the use of healthcare services, as I mentioned, through alleviating the different barriers that may affect caregivers to take their children to receiving those healthcare services. So what's interesting in the literature, and a gap that I did notice, was that while, so coming from an economics background, of course, and looking at these relationships of the economic preferences that they have, like that a person can have and how that predicts the health-seeking behavior. And if we're looking at a person receiving a cash transfer program and they have to seek these healthcare services, I noticed that there was a gap in terms of assessing whether the differences in the way the preferences would affect these health-seeking behaviors. So because of that, I felt I wanted to investigate whether or not this sort of preferences would amplify or dampen the intended cash transfer program effects. So, which leads me into my research questions for that particular paper. So the first one was, what is the impact of the cash transfer on child health utilization in Kenya? And the second one, which was my main, I guess my primary questions of interest, was to assess whether or not time and risk preferences moderated these cash transfer impacts on child healthcare utilization. So just in briefly going over in terms of like framing, I used the conceptual framework in terms of how I hypothesized these relationships would be. Of course, I used the economic literature and public health literature to come up with this framework. So in terms of like the relationship that I was interested in assessing is this sort of cash transfer effect on child health utilization, but looking at how economic preferences moderate this relationship. And the reason I thought this would be a moderating relationship is because prior work that has already assessed this cash transfer program impacts on economic preferences of caregivers receiving these resources has found no effect. There's been no effect on this economic preferences. So that's why I hypothesized that this would be a moderating effect. So, and of course, there are other factors such as household, individual, and community characteristics that would affect these relationships that I control for in the models that I used. So just to briefly go over the time preference variable that I used in my study. So time preference refers to the valuation of current consumption of a good or service determined by their valuation of future consumption. So the beauty of the data that the transfer data, the impact evaluation data for the Kenya cash transfer program is that it had a module that was assessing the preferences of caregivers. So it had about 5 questions that were asking caregivers, getting caregivers' responses to a hypothetical scenario about whether a choice of receiving a cash today versus a different amount in the future. So this sort of evaluates how they value the present consumption versus expected future benefits. So this was asked 5 times and the amount received later on was varied. So based off of this scenarios, I created a binary measure to represent a person with a low discount rate. That is a person who's more patient. And that would be a person who was willing to wait for the income, for the money later on as a binary variable. So I categorized this and made this a binary variable. And similarly for the risk preference, and risk preferences measure reflects an individual's preference for a certain payoff to an uncertain one. And similarly, there was questions, hypothetical scenario asked that were trying to capture a caregiver's risk preference. And this involved asking them a choice of receiving a certain an amount for sure, versus a choice of a 50% chance of getting a higher amount or nothing, for instance. And 5 different scenarios were asked of these caregivers. And in a similar manner to the time preference measure, I created a binary measure to reflect a person who was a person who was always willing to choose not to choose the gamble, because I wanted to understand whether a person who was more risk averse would actually take their child to seek more healthcare. So in terms of the study measures that I used in the study. There was a number of child health utilization measures, so such as whether or not a child had a healthcare card, whether or not they received a polio vaccination, as well as tuberculosis vaccination, and yes, a number of other variables related to the child health utilization. And of course, the main independent variable of interest was whether or not the child in the household received the cash transfer versus whether they didn't. So in terms of the analysis that I use linear predictability models for, of course, where the outcome was of the binary measure, but because I also had count variable, like I had the count variables, whether the number of times that they received the certain vaccinations. I also use OLS regressions and controlled for year and district fixed effects and robust standard errors. So to answer the first question that I mentioned, where I was just measuring the impact of the cash transfer on child hospitalization, before I start including the preferences, I used a difference in difference model. And to assess the moderating impacts of the economic preferences, I use a triple difference model. The significance level was tested at 0.05. And I did conduct a number of sensitivity analysis, but just wanted to highlight one because with the way the child healthcare measures were reported, collected rather in the data, there were some measures that were obtained from the healthcare card, and I think the healthcare card is a very good indication of child hospitalization because those are usually given at the point of contact with the healthcare facility. So there were some measures that were on there, and for where the interviews or where the healthcare card wasn't available, the interviews, those collected self-reported measures. So I just wanted to test to see whether if we separated by those two, if it changed the findings of the main findings. So in terms of the summary statistics of this paper, so just to highlight just a few things, the average age for the children in the sample was 3, as well as the education, the highest education, majority of the household kids or the caregivers that had no schooling, and that was 41%. And looking at the question of what is the effect of the cash transfer on having a healthcare card, as mentioned, I did use a difference in difference model for all the outcomes that were assessed, but I'm just showing just for the healthcare card, just to show you briefly like what I found. And similar to prior studies, because I know this was, I think, covered by one of the reports from one of the transfer project teams, I think, and similar to what they found, there was no effect when looking at the impact of the cash transfer. However, when we incorporate the time preference model, the time preference variable, and interact that with the cash transfer and following the baseline period, and then we find a significant effect of this cash transfer program. My slides are moving quicker than I am. So in terms of like the main finding, the time preferences do moderate cash transfer program effects on child healthcare utilization. And this effect, like I showed you previously, was the effect found on the healthcare card, but this was also found for tuberculosis vaccination, for polio vaccination, for the flu vaccination, as well as the number of times a child received the polio vaccination. However, with regards to the risk aversion measure, the risk preference measure, we did not find any significant moderating effects. And the sensitivity analysis showed that the results were not sensitive to the classification of the outcomes. So in terms of the main policy conclusions, the conclusion and the main policy implications of the paper is that, of course, as mentioned, the time preferences do moderate the cash transfer program impacts on child health utilization. And for me, I thought this was a very important thing in terms of moving forward if we are designing impact evaluation studies to assess different cash transfer programs, to incorporate these modules that study these economic preferences, because we're definitely seeing that there are these differences, and we might conclude that these are not effective programs yet. It's just because of the way that we are assessing it, and it just might be due to the differences that we haven't been studying prior. In terms of at a policy level, this study could advocate for increased resource allocation to different social protection programs, and This could mean continuation of discontinued programs, cash transfer programs, or expansion of existing ones. And aligned to existing cash transfer programs could be, because we're finding these differences by the preferences, something that additional that could be done would be to add this additional health programming to the cash transfers, such that you're trying to reach those with a higher discount rates because they are less likely to take their child for healthcare services. So I also wanted to go into, because of course I've talked about my journey of giving you briefly on my dissertation, but I just wanted to highlight some of the, I think the main challenges that I faced throughout my career and also just through my academic and both my academic and professional career. So, I was fortunate enough to work for like big institutions that were internationally representative that looked good on, you know, on my CV and helped me get further opportunities. But I realized that there was a lack of growth with regards to applying the skills that I got from my university, like the technical skills, such that when engaged as early on in your career, like the skills were limited, my tasks were limited to data collection. So would have international experts, and this was when I was working in Zambia, international experts, they'll come, but they'll always come with their own team, and there was not enough room for collaboration to be able to engage as a local graduate, I guess. There was not enough scope for me to actually engage and be part of the research beyond going to collect data like from a ministry, for instance. And even when you did so contribute to some of the research works that were happening, there was just no acknowledgement or any form of, by the end of it, you have no, there's no product for you to show and put your name on and say, okay, I did this work that could help advance your career. And also notice that in the same way, there was just a lack of mentorship early on to sort of guide, because I feel like my mentorship opportunities, and I noticed I got a lot more mentorship as I have grown more so in my career and throughout my PhD studies. And another thing that I also found was a challenge was because I'm interested in global health, of course, like coming from my background and living and working in a developing country. I've always been interested in global health, but most of the spaces that I found that when dealing with like public health and like being in this health space is there's a lot of emphasis, there's a lot more information about what data sets to use, for instance, like United States data sets, and very little discussion about the global health data sets that we could tap into to answer different research questions. But of course, I've had a number of things that have helped in terms of at least getting to where I am and helping me get to be on the path that I'm heading towards. So some of the things that I thought were like good to share was just how prior to coming to the United States and being an African student, just that linkage, like my university was very good at linking me with other African students already in the university. So it was easy for me to make that move because like I had somebody I could talk to with the same contextual background, and I could ask the questions that I knew were relevant and that I could get the answers from. So I thought that was really good. And of course, because I mentioned like, while there isn't, so if for instance, like the university like had very little space for global health work, it was there, but very little. So what I felt was it's really a good step to invite guest lecturers who are related to interests of students. So Dr. Palermo actually came and gave a talk for I think that was a health disparities class. And that's when I heard about the work that she was doing, heard about the transfer project, and got in touch with her to be on my dissertation committee, which I really, really appreciate. So that also really helped, because then I got to do a lot of the work that I really wanted to work on in the countries that I am interested in. Another thing that I also thought was also, I really got a good opportunity to just get exposed to different types of work. So my department had a strong emphasis on pursuing fellowship opportunities. So I did participate in a number of fellowships. So I just completed a fellowship, an Africa fellowship with the World Bank, where I got to work in an international organization dealing with international health. And that's where I did most of the work around COVID and this additional financing projects to roll out COVID vaccinations into the Eastern African region countries. But prior to that, I also worked for a health economic consulting firm where I was conducting, pretty much helping out with the research, like on different topics. But this was obviously a client-based and a private sector. So it was it's a very nice opportunity to see, sort of gauge where I wanted to go in terms of my career. And also, in addition, there's other opportunities that exist, like with the professional networks. So I did apply for the Equity and Inclusion Fellowship, and this was a really, really good chance to get exposed to a network outside of my university, because through this fellowship, I was paired with a mentor who had a background similar to mine. And in a similar way, I also was a research scholar for the Sadie Collective. That is another platform that encourages women in economics. So that was also a really good helping me network and just get ideas, and sometimes just even talk about other opportunities for other collaboration. So just to conclude, in terms of just like some of my recommendations, and of course, in addition to some of them are, in addition to like what I've mentioned as the best practices, I think the promotion of access to different networks and external experts, as I mentioned, outside the university, especially if there's a preference like by students to indicate that, okay, they would appreciate to look at this topic. I think promoting the access to and providing platforms that could actually engage into external expertise would be really great. And another thing that I wanted to mention was just about the promotion of the different PhD programs on different platforms. And also just because of where I learned about the PhD program in my department. So as mentioned, I did study at the University of Cape Town, and I had a mentor from there. And he attended a conference where there was a professor from the VCU and Dr. Green. And she's the one who told my other mentor about this PhD program. And he communicated this to me and told me about it. So, and not to say that this should be like a formal process of promotion of the PhD programs, but just even talking about like, okay, this is a kind of program. So if you know any students, I think that is really helpful, especially in connecting when I specifically singled out international conferences, because I'm thinking of opportunities for other academics to, come to the United States and get the expertise from here to use to further their agenda in their home countries. And of course, I've talked about this public data sets with PhD students, and I think that is also important, especially global data sets. I think, especially for students who are interested in that kind of work. And I did mention the linkage of incoming PhD students with other students already in the university from the same region. So I think that is also really helpful. So thank you so much just for listening, and I hope you took something out of what I shared, and I look forward to engaging with you more on anything that I discussed or any other questions that you may have. Thank you.
Thank you very much. I have so many observations and questions, but I don't want to hoard the time here thinking about time preferences. I want to make sure that our attendees and colleagues have a chance to offer insights or raise questions. And while they are all thinking, I want to thank both of you, Tia, for a fantastic overview for those of us who don't think transfer programs all the time. So thanks for that overview. And Muloongo, I really appreciated both the introduction to how the work came to be, but also the deep dive into the findings and leaving us with guidance on how to support early career scholars and thinking about all the enablers and barriers. So I appreciate it very much. So we have students on the call as well as some faculty, and if we don't hear from them soon, I'm going to start with my question, if I may. The first question is actually, Muloongo, tied to the substantive findings of your work. I was really intrigued by the role of time preference and how you reported it. Could you maybe share a little bit more on why you think time preference plays a role in the impact of the cash transfer program?
Sure. So as mentioned, these time preferences measure, I'm getting some feedback. Hello?
I'll mute myself.
Okay, thank you. Yeah, as mentioned, this time preference is the extent to which an individual discounts the future benefits and costs, such that their preferences for current consumption of good is determined by how they value the expected future return. So in thinking about the cash transfer, when the caregiver receives this, this cash, I was thinking of it in terms of they receive this cash and they evaluate the trade-off between the cost of using the resources now versus if they take their child, they use it to, if they take their child, then the expected future benefit that they will get. So of course, with time preference, there's no exact way to measure it. So this kinds of exercises kind of give this hypothetical scenarios, and like the one that I described, sort of give an estimation of how they value doing things now as opposed to like the future expected benefits. So that is sort of what guided my thinking in terms of how this relationship would actually play out.
Very interesting. My mind went there in part, you have no reason to know this, but I work on food in the US context. And there are funds that are released to people in the United States to help them access food, to purchase it and procure it. And there's a timed nature of when those funds are released. And I have often wondered the decision making around that and how it's tied to people's time preferences. And your methodological approach got me thinking about how your approach might be of real interest in the US context as well. So it was a methodological thing that got me fired there. Thank you. I have a few other questions, but I see that Dr. Cordes is here, who is the co-director for Community for Global Health Equity. So welcome, Kasha. And if you would like to offer an observation or start off with a question, please do so.
Thank you. I really appreciate that. And I'm sorry I'm joining late from another conference that I was attending today. So I caught the latter part of the presentation, and I had some questions about the observations that you made about training programs. And I wonder if you could comment, and if you don't feel comfortable with commenting on this, then that's okay. But you know, there's different ways of building equity. There's equity in research and community participation in research and community driving research. But some of the things that you touched on were related to equity in access to research resources and providing Global South scholars with an opportunity to have both the same opportunities as well as the same voice as experts. And I wonder, so that's my preamble to my question. So I wonder if you would be willing to comment about, I know that the observations that you were making were in reference to your own experience as a student who came to the United States to study and the supports and barriers that you saw. But I wonder if you could talk about that in reference to those students who remain in South Africa, for example, or who remain in other African or Global South countries, and what are those things that should be as support for them, and what you see as barriers. So again, that's kind of a long question, but if you feel commenting on any part of that, then I'd really appreciate it.
Sure, I mean, I could say a little bit about that. Having been a student in South Africa and in Namibia, and so you talked about like what some of the barriers are for students who are, I think it's probably, I would say it's the same situation, because in terms of like thinking about the same barriers of not being able to participate actively in research that's being conducted in your country. So it's the same situation. And I remember being a student in South Africa, but also like still having international experts, and that even this international experts, what that even means, because you have local experts as well, trained in good universities as well, in the universities in the country. However, it still comes down to the same thing, is because you don't really have the opportunity to take part in some of the research that influences that. You don't have the opportunity to be engaged by the bigger NGOs that are looking to conduct work in the particular country, because they're always looking outwards. So there isn't that space for students to do that and just participate, in that kind of work. And I believe, because I remember still being a data collector, even when I was in at the University of Cape Town, before I was actually given that opportunity to actually be involved in the research, when I could have learned from these experts. Yeah. Some of the things that I feel I guess it's the same way. These platforms, in the same way I was talking about, like these sort of engagements and interactions with other experts. Like I was saying, my mentor from my old university, who ended up connecting with another mentor at an international conference. I think even engaging students from Africa, like, and encouraging those platforms, like if those can exist for students to actually participate, as well as with other students. And it doesn't need to just necessarily be those of African origin, but if those platforms would exist. So taking the framework of like the way the Association for Policy Analysis and Management, so that not the Africa Fellowship, that fellowship, the Equity and Inclusion Fellowship, was primarily for, students in different universities. If we could have something like that, that engages students in the United States and different countries, and specifically drawing on to connect like with those from the African countries as well. So I feel that would help that interaction to share ideas, share the updates, because it's no secret that now, like the universities, especially like in the sciences, there's more advancement here as opposed to countries, universities and countries in developing countries. So I think creating those platforms for even just students to have those fellowships and interact with each other, because I still interact with my fellows from my cohort, whichever fellowship it's been. So that's also a good platform as well. Off the top of my head, those are the things I can think of, yeah.
Thank you.
Thank you. I am going to switch to Tia, if I may. This is a bit of a parallel question to what Kasha raised for Muloongo. You have worked with colleagues in the Global South. You have clearly worked with a student, now colleague. If you were to reflect back on your career when you started work versus where you are at now, what were the kind of pivot points that got you thinking about how you engage in mentoring, how you engage in research relationships? And the motivation for this question that I'm asking is because I'm pretty sure that researchers have good intentions, but what causes some who are trained and based out of the US or the global north to pivot and think about more equal, egalitarian relationships? Speak to that, if you will.
Yeah, that's a really big question, and I have a lot of thoughts on that. And I, when I was speaking with Muloongo about, the possibility of doing this presentation, I really did want her, as she did with the challenges, to really push us, because I think, to be a little bit like not controversial, because everything she's saying is very true, but just kind of make difficult conversations for us so that we can face these realities and address these realities. And so I thank her for raising some of these very, true ongoing issues. I think with my own work, if I look back, I think I was given a lot of opportunities being someone from the global north to engage in the global south in a way that, you know, there was a lot of privilege and prioritizing of my work over other people in possibly local contexts that probably had a lot more expertise. You know, I worked with some NGOs where I was doing the backstopping, which backstopping is such a strange word that basically means, you know, coordinating people and providing technical support to people in other countries that are, you know, doing the work. I think I'm rambling a little bit here, but you know, I think working for those NGOs as a researcher, I was, you know, sent to different places to kind of lead research in contexts that in a way that I wouldn't do that now. And so I was kind of privileged and given these opportunities and sent to work in different places in Latin America and in Africa in ways that I wouldn't develop those relationships now. So now what I've tried to do, and just listening to a lot of people, a lot of partners, a lot of collaborators and students, and also, you know, following a lot of the discourse on decolonization of global health research, you know, I've taken a lot of that to heart, and I feel like I'm on a journey of, you know, trying to make what I do in my own actions more equitable. I don't think I'm always, you know, I don't think I'm 100% there yet where I'm always doing, you know, the right thing, but I'm trying to kind of, you know, just little small steps. And in just some examples, like, you know, working with local partners, like making them first or last author. You know, I think Muloongo was talking about some instances where people weren't even offered the opportunity of co-authorship. And I think that's, you know, egregious. But it's not enough to just stick someone's name in the middle of the paper. You know, if the first and the senior authors are the most respected, we need to recognize the local expertise on the ground and make them first or last author. Because this work is not possible without people in the context where we're working, and we need to recognize that expertise and that contribution. I try a lot to promote opportunities for people that I'm working with in different settings by, you know, forwarding them fellowships to apply for, by helping them submit conference abstracts, and, you know, ensuring that they're the person that's going to be presenting our joint work. So those are kind of some of the things I've thought about, and I you know, I have a lot more thoughts on that, but I feel like I've been going on for a bit. So maybe I'll stop there and see if it addresses your question, or if you want me to address something further.
That's a great start. You know, it got your comments, Tia, got me thinking about Muloongo drew this trajectory on one of her slides, and then you are describing your trajectory. And I think one of the takeaways for me is to remember that just the way our research has a trajectory, researchers have a trajectory too at all stages of their career, and that regardless of whether you are a seasoned professor or a new scholar, we can contribute to building equity from all of those positions. And so that's what I was trying to listen for, and you gave lots of ideas about how you pivoted. It's certainly the case for me as well, as I think about the work that I do in or with communities. I have to say, as I'm listening to both of you, a particular scholar is speaking to me from another place. So I'm going to name her, because what both of you are saying is reflected in her body of work, and it would be a missed opportunity to not name her. She's not from your field, either of you, but I think you will find some theoretical kinship with her. So her name is Vanessa Watson, and she was actually at the University of Cape Town, Muloongo. And she was an urban planning theorist and did a lot of work on urban planning. And her, it's really difficult to summarize the kind of giant she was in the field of urban planning. And clearly not from public health. But one of the things that she talked repeatedly, and it's in her body of scholarship, is how planning ideas from the global north not only are they inappropriate in the African context, but even the theoretical formulation of them needs to be produced from the African context. And she really turned people's head on how ideas are generated and where theory comes from. And just side note, she also ended up establishing an association of African planning schools because of the point that you made, Muloongo, about expertise actually existing in South Africa and in African countries, but not being recognized sometimes more broadly. So she did a ton of organizing around that. And as I'm listening to the two of you, her words and ideas are coming into my head. Coincidentally, she spoke at one of the webinars that CGHE had organized. So I hope that we all get to see the work that she did as well. I have a couple other questions, and we actually have a question from an attendee who dropped it in the chat. So I'm going to raise it if I may, and it can go to either one of you. So this actually is a question tied to data governance. And Tia, you talked about making data publicly available. In the US context, there's actually conversations about who owns data. And then Muloongo, you talked about, access to data for your own research. So the question maybe starting with Muloongo is, have you observed that large think tanks or private entities actually have data on the topics and countries that you are interested in, and that they don't release it? And did you experience that? And if yes, how did you overcome that?
Yeah, I mean, that's definitely the case. Sometimes you could hear of data sets that are available and or even data sets from your own country that you can see the work's being published, but you don't have access to. And sometimes it could just be for political reasons. And we know you can't say much about like what goes on behind, but it really is, it can be a frustrating thing if you want to work on a particular data set, but you can't get it. And then by the time that data set becomes publicly available, it's, outdated, so to say. But yeah, so I definitely have experienced that. And I think that's definitely a challenge as a PhD student who doesn't have funds to even pay for access to some of these more secure data sets. There's data sources as well. So you have to be very creative. And that's why I appreciate that the data that I was able to get I could answer the questions that I really wanted to get. So like, for instance, like conducting a cost effectiveness study, most of the time, like you need access to trial data, which is very, very hard to get, So I appreciate that there was a publicly available data set that I could get my hands on to conduct that study. So, yeah.
This question actually comes from a student who has been in a setting where they observed that there was data, but they couldn't get it. So they're looking for tips from you. So the next question is a little bit futuristic, and it's also directed to Muloongo. And the question is, what are your aspirations and your career goals? What are you thinking about 5 years, 6 years? And how do you go about planning and charting a future for yourself?
Yeah. That's a very interesting question, because before, so while I was doing my PhD, I knew what I didn't want to do. I knew I didn't want to be in academia. And now, having been at the CDC for, I think it's like about 2 months, and I'm enjoying, because with the way the fellowship is structured, we have the extramural projects where we provide technical advice to the projects that they're funding, but there's also a huge part of it is coming up with your own research topics. So I realized that I'm enjoying the process a lot more, and it's something that I want to further along. So that is, in terms of thinking about careers, I'm thinking of getting into in academia. So I'm thinking that's where I'm at now, because I want to be in that space where I can be creative with the types of research that I want to do. So remember I said that when I was working at the NGO in my country, there was questions I wanted to ask, and there's still those questions that I really want to answer. So a lot of the time we were advocating, and it became like a song, like, you just keep saying, oh, we need to allocate 15% of the budget to, for instance, the health sector. It's something that we kept saying, and this came from prior work that was done, but at least I haven't come across work that has actually evaluated, okay, if we're going to do this and we're not really specifically assessing how these resource allocations are going and where they're going to be most impactful. So that's kind of scope of work I'm trying to do. And the beauty of the fellowship that I'm in is that there's a lot of emphasis on these mathematical modeling techniques. So that's the skill set I'm building, such that in a place like, like in Africa, where there's just limited data, without even having access to data sources, we could sort of pull from existing things, some different methods, which I'm finding very interesting to be able to answer questions that we primarily would need lots of money to collect that data. So that's how I'm thinking about things right now. Yeah.
Thanks for sharing that. I think it's hopeful for students who are maybe even earlier in their career to learn about your process and your kind of thinking. So it's super helpful. Tia, I have a follow-up question for you, and then Kasha might have a question as well. My question for you is, it's not easy to straddle that role of meeting the metrics of being a faculty member in the United States and still doing right by your partners. There's actually significant cost to an early career faculty who's on tenure tracks. So what are your tips for faculty who might be at US universities where structures may not be really set up to facilitate this building blocks of equity? What are some tactical ways that faculty can do what you have done or you are trying to do?
Yeah, that's kind of a tricky question. It cuts right to the.
Maybe I can also change the question slightly. What advice do you have for universities on how they might support early career faculty to engage in more equitable relationships? How about that?
Yeah, so I think, equity has to start with the finances, money talks. And one of the ways that we need to strive for more equity is by paying our local collaborators what they're worth, similar rates. Like, we shouldn't be paying, Americans like $500, $600, $700 a day, and then people in other countries like $250 a day that might have the same qualifications that you do. So, we need to think about equitable pay rates for individuals and individual time, but at the same time, I think, another thinking, and I'll get to your question about universities, but I think international donors also need to be providing more core resources to universities and research institutes in the global South, so that people aren't on this hamster wheel of having to go from one contract to the other. Because what I see in my own personal experience is that people don't have the time to develop their own research agenda because they don't have some of the protected time that we have. Especially research institutes. So not only are they don't have that resource in terms of time and finances to support their time, there's lower levels of funding available in most of these countries. And so, a lot of the big funders are from Europe, like the UK or the US, and they are primarily funding their own researchers to collaborate in the global South. And that's where it becomes tricky, as what I think you're alluding to, in terms of paying for the time of the people, both in the global North and the global South. So how do you allocate limited amounts of money to people's time? And then how do you kind of share the credit for the deliverables out of those. And I think that's one of the things I was talking about in terms of papers. It's a much larger discussion, but you're talking about the metrics that we're judged on. And we're judged on the money that we bring to our institution and the number of publications that we have, and where does our name sit in those publications. And so I think you're very right that the incentives really don't match some of the solutions to these inequities. And one of the things I think institutions can do is, in their consideration of promotion, they can consider other metrics in terms of impact of your work. And impact can be framed not only as how is your work being used, but how are you building capacity in the settings that you're working. So if you're using European or US money to work in a global south context, are you doing parachute research or are you building capacity? And it's really hard because building the capacity, mentoring people, and providing opportunities for people, as well as having impact of your work. It's not enough to get a journal article if nobody's reading that journal article. So you write a brief so that you can translate it to policymakers. And then you sit with policymakers in a workshop and you talk about the findings and you say, what do you think about this finding? What do you think we're missing? And all of that takes a lot of time that you're not investing in some of these other activities that are going to produce the metrics that you need for promotion. And so I think you're hitting me on a very raw topic at the moment. So I'll stop there.
Thank you, Tia. Apologies for putting you on the spot. I firmly believe that we are collectively, both academics in the global north and south, our community partners and policy leaders are such a creative bunch that if we have contributed to creating a problem, that we can also figure out a solution. So you definitely gave us some things to think about on how we might approach the things that we have to address in building more equitable relationships and partnerships. Kasha, I want to make sure that you have an opportunity to jump in because you might have a question.
I do, and this one is for Muloongo as well, and this one may also be one that feels a little bit raw, so if you don't want to answer it, that's okay. But one of the things that I have heard from my colleagues at a variety of academic institutions who are faculty of color is that they are being approached by students to provide mentorship, and they certainly want to do that, be the mentors, but they are also being approached to serve on a number of committees, and so it feels like they're being pulled in so many different directions that it doesn't allow them the time and space to do deep thinking and deep work in order to advance their scholarship and advance their career. And I wonder if even at your stage, if this is something that you are encountering, as I'm sure you said already that you're in touch with people at your previous universities and are part of these networks. I wonder if this is something that you're experiencing even at this stage, and whether you have anything that you feel would be a good solution for your institutions to support you. And so I wonder if you could speak to that. And again, if you don't feel comfortable, that's fine.
So are you asking if I'm experiencing as the person being approached, or are you asking if I've experienced approaching and not having the person be accessible? Sorry.
No, I'm asking if you're being approached to be the mentor and pulled in lots of different directions already at this stage, and what you think might be a good way to support you as you're providing mentorship.
Right, right. So with the way, at this stage, no, I would say no, I'm not experiencing that. I am experiencing a lot of, not per se mentorship, but a sort of, but I guess it's mentorship in another way, but support for different like research projects, support for different, from different colleagues trying to start up NGOs, are trying to do a lot of work, but I am overwhelmed for the most part. So it's a very challenging thing, but I think looking back, and I'm going to put myself on the other position of asking somebody to be wanting to work somebody and not having them be available, or putting myself, but I think the best thing is if just proper communication, I would say. And if even if you can't support in the capacity that they are requesting, or even if I can't support in the capacity that they're requesting, just showing that I could support in other means, and just let them know when I could be available for the said activity or engagement. Yeah.
Good communication, that is a great tip for all of us. I am so grateful for the candid conversation, the ideas, and what a fantastic way to build equity through this conversation. In the spirit of making sure that colleagues know where to find your work, Tia will drop your website in the chat shortly, but Muloongo will please let us know, stay in touch, let us know what you're working on next, and we would be delighted to learn more about the next papers that are coming out of the Kenya study. We are grateful to both of you and to our attendees who joined in. Thank you for helping us unpack all the ways in which we can build equity through collaborative work. Goodbye, everybody. This is the formal end of our program. That said, our next seminar is on December 2nd, so whoever is listening, please come back if you have the opportunity. Goodbye.